Next up, we have another speaker, Dr. Shaw-Ruey Lyu, who is a renowned surgeon and the current chief of the Department of Education and the Joint Center at the Da-Lin General Hospital. He also has many research publications related to medical science. Please welcome him to the stage.
I have my slide. Good afternoon, TIMA members, distinguished guests. First, I would like to thank the TIMA committee for inviting me to here to join the wonderful meeting. I'm enjoying it very much. I was delighted that I have the chance to introduce my concept of total management for the knee osteoarthritis, and I call it KHPO. First, I will show you the severe case. You can see the very severe deformity and unstable gait of this lady. And this is her X-ray. We can show the severe deformity. Before my talk, I will show you some real cases, and they are willing to share their experience of suffering. The first one is a 59-year-old female and suffering from knee pain for years. And she will tell you the common symptom of this common disease.
退化性关节炎，又是酸痛啊！你走一走，你就要休息一下，不然就是快要跪下去，这样很不舒服。
And the second case is a 70-year-old retired man. And he suffered from knee pain for 50 years. And we can see the X-ray showed stage 4 osteoarthritis over his right knee.
这个50几年的痛，我都可以忍受。差不多4年前，忽然一天2、3次，关节的后面那一点会软下去，会好像抽筋的那个味道，就是会把你绑住，不能动。这个之前我也在几家大医院看过，医生都认为这个一定要换人工关节。
And the third case is a 76-year-old housewife, also suffering from knee pain for 50 more years. And this is, you can see the terribly deformed knee of both of her knee. After one of her knee, the left side, has been replaced by total knee replacement, we can see the significant difference between two legs.
安尼差不多5六档啊，都拢袂行，无当行是无倒啊，安那无好，倒向向摔倒啊，有时咧摔就对啦。
But not only aged people suffer from this disease. There are many, many young people have the same problem. Just as this English teacher, 49 years old, suffering from knee pain for 5 years and was confined to wheelchairs. And this is her x-ray. We can see very, very mild joint space narrowing. Over here.
I will describe fins mapping.
那时候我完全没有危机意识但是很快的，奇怪，这个一点点痛怎么持续的存在啊？我就知道不对了，我就开始看医生，看了结果是，他们都鼓励我复健，他们说复健看看啊，或者是痛的时候偶尔吃个止痛药啦。
This disease is a worldwide big problem. It's a very common impact to the human society. And about 1 of 5 people will suffer from this disease. And it is one of the 5 main causes of disability for population older than 65 years old and decrease the life quality of them. Let us see the prevalence of this disease. In both Western and Eastern world, the prevalence is around 10 to 20% in population older than 60 years old, and it is more prevalent in female. If we look at the Google search, there are hundreds of millions of pieces of information. All are talking about the traditional and the mainstream knowledge. The cause is unknown, and the degeneration is ongoing and irreversible, and the damaged cartilage will not regenerate. And this disease could not be cured, and knee replacement will be the final destiny. And before the knee was replaced, all the treatments are conservative and passive, like painkiller, nutrition supplements such as glucosamine, HA injection or PRP injection, and sometimes arthroscopic lavage or debridement and osteotomy. So this is a natural cause. This patient, just 2.5 years, from here to here, they replaced. So this is the mainstream medicine. Sometimes complication will happen by the traditional mainstream medicine. Like this patient, he was mistreated by prednisolone. 8 months after the treatment, the medial compartment become collapsed and needs to be replaced. This is other terrible complication. This patient received repeated injection of HA and PRP and got infected. So we should perform 2-stage operation. The first one to remove the dead bone and infected tissue and put in the antibiotic piece. And 3 months later, put in the very big prosthesis to rescue her knee. If needed, I'm not to perform total knee replacement. Our team could get 97% of satisfactory rate, and presently around 300 patients per year receive knee replacement in our center and have very satisfied outcome. For example, like this 67 years old female, just 1 month after her knee was replaced, she can bend her knee nicely and can do the squatting activity. But the mainstream arthroplasty still have some concerns. The first one is that in current technology, we still could not restore normal physiological function. Patient will always feel a feeling of strange about her prosthesis. And according to a recent literature, about 30 to 40% of patients having been repressed still suffer from pains or discomforts with unknown origin. And most importantly, we should make the patient realize that this is a path of no return. If the knee once being repressed, the patient burned the bridge behind her or him. And occasionally, there is still some severe complication, such as infection or wearing of prosthesis. Like this patient, after 3 years of successful replacement, he still got infection and needs 2-stage revision. For aged people, it's suffering. And this is a case of wearing of the prosthesis. You can see, and you need. Maybe I can fit the microphone. This poor lady came to me after 7 surgeries due to infected prosthesis. And I cut all the infected bone and used a very huge custom-made prosthesis. Every time when I meet these complicated cases, I will think, why the knee degenerates? Why the knee degenerates? In the mainstream medicine, this is still an unsolved problem because the etiology is still not clear, so we cannot prevent it, we cannot treat it effectively, and we cannot cure it. Let us see the voyage of life. Everyone is born with cure and lead a very happy childhood. But why, when you get old, we have very, very different, like the green one curve and the red curve. So why the knee degenerated? When we see the patient, it's always in its disability stage. What happened in the early stage? For example, in our middle life, we are all busy for our career and family. And what happened here? So I think if we want to know the cause of the degeneration, we should look into this earlier stage. For centuries, from left to right is a dream outcome of researchers and all the medical personnel. I will tell you that this is one of my patients. Just 1 year after he received KHPO treatment. So, from now on, I'm going to talk about the KHPO, the total solution of this common disease. About 20 years ago, I find an accidental finding in arthroscopic examination made a hypothesis. And then, after 15 years of translational research, I published 12 papers and 1 book chapter. They all conceptualize one novel but very simple concept. By using this concept, I designed 3 very variable strategies, and I call it the knee health promotion option for the comprehensive treatment of knee osteoarthritis. The Chinese philosopher said that misfortunes often lie concealed in trifles and burst forth when least expected. And the trifle here, I call it the hidden killer, is the medial breaker. Almost everybody was born with this structure in his knee. Yeah. It's a fold of the synovial membrane. The left side is the young one, and the right side is the old one. And the medial breaker will cause a very important phenomenon. I call it medial abrasion phenomenon. And this is the arthroscopic view. We can see the pathologic medial breaker at the repeated abrasion on the knee. And this is a gross view when we perform arthroscopy and see the thickened medial breaker abrades the bone, the cartilage beneath it. And the abrasion phenomenon will cause cartilage damage over the medial side of the patellofemoral joint. This is a mild one, and for more severe one, we can see over here. All are caused by the medial breaker, cause the abrasion of the underlying cartilage. And I also found that the size of the breaker affects the damage of the cartilage. For a smaller one, less damage. A larger one causes more severe damage. So all of these are indirect findings. Yeah. From this picture, we can see here is the site of abrasion. And here is the location which represents the narrowing of the X-ray examination. And it's a pity that all the researcher and clinician focus on here and not here. So this side is ignored. From this picture, we also have a very interesting finding over here. We can see the same patient, the same age, so different. Here, the cartilage completely healthy. So this picture improved the mainstream medicine, saying that the osteoarthritis of the knee is due to aging. Yeah. Because the same age, why we have this different? So it must be the local condition, cause the damage of the cartilage. So what is the relationship of the primary lesion and the second lesion? I want to prove it. So I organized a research team in 2002. And we conduct many projects to look into such interested subjects. And this is the papers we published here now, and the book chapter. All of this is conceptualized into this finite element model. The repeated abrasion occur average 1 million times per year, and it will cause local physical abrasion. This is our study. We find that in the middle-aged people, the Young's module is about 60. And we put in this data and find that if we bend our knee exceeds 60 degrees, the pressure of the breaker will cause damaging local pressure larger than 10 megapascal. And the second one is the breaker itself. After repeated impingement and inflammation, it will secrete cartilage damaging enzyme. So we take out the synovium and do some immunohistological study and found that there are high concentration of interleukin-1, beta, and MMP3. So this proves that the chemical erosion can damage the focal cartilage of the medial compartment. So both of the physical abrasion and the chemical erosion will damage the medial side of the knee joint. And the cartilage debris will accumulate over here and cause third-party abrasion. So the three factors result in the continual apoptosis and degradation of the matrix of the cartilage. So this is the very, very simple concept. Maybe everyone now, you will feel discomfort over your medial side of the knee. To let you be more impressed, I will share you the inspiration from water I got in 2002 when I have a family trip around the Icefield Parkway after my conference in Toronto. Along the Icefield Parkway, I see a lot of magnificent manifestation of water. When it comes down, it just looked like a mirror, like the Lake Louise. And its power can separate the mountain. But usually, they just carve a very graceful canyon like this one. This is Johnston Canyon. And by the water side of the canyon, I see a prêtre standing silently there. Immediately, I found a poem printed in it, and it startled me very much. Let me read it for you. The canyon. There is hardly any sky here. The air is cool and full of the sound of water. Everything is water and rock. Water carrying rock, breaking rock, water carrying rock away. How about making some modification? The knee. There is hardly any sky here. The air is cool and full of the sound of medial abrasion. Everything is medial breaker and cartilage. Medial breaker carving cartilage. Medial breaker breaking cartilage and carrying cartilage away. And the foreign paragraph are more fascinating. It is talking about the result of the abrasion. So the shapes you will see in this canyon are always changing. The rock dictates where the creek will run, but the water decides what rock will stay or go, and whether it will go now or later. And this is the modification. The shapes you will see in the knee are always changing. Cartilage dictates what the knee looks like, but medial breaker decides which cartilage will stay or go, and whether it will go now or later. So this point do encourage me to continue my research at that time. For summary, let us see this simulation of physical abrasion. The medial breaker become more and more thick as your age become older and cause me the focal abrasion. And the particle will accumulate in the medial compartment. And the chemical erosion happen in the breaker side. The breaker being impinged and inflamed repeatedly. And I think the chemical erosion is more powerful than the physical abrasion. So in the traditional medicine, only 10% of knee osteoarthritis have clear causes, mainly because of trauma, such as a meniscus tear, ACL injury, and so on. But other 90% are regarded as degeneration, just because the cause is still unknown. Our finding of medial abrasion phenomenon, we found that it's account on 95% of the above 90% of unknown origin. Okay. So we can put the medial abrasion phenomenon over here. And it will explain why some people will degenerate, some people will not. This is a life cycle of the knee related to medial abrasion phenomenon. Let me first put in the stage of the degeneration. This is a normal knee. We can see from the arthroscopic finding, the cartilage surface is very smooth and white, so it's normal. And this one, the space of the X-ray is still normal, but by arthroscopic examination, the surface is uneven, and sometimes we're bubbling. So this is stage 1. This is stage 2, degeneration. We can see some narrowing of the space. And by arthroscopic finding, we can see some fissuring or bubbling of the cartilage. And the stage 3 osteoarthritis, besides narrowing of joint space, we could see some spur over here. And the arthroscopic finding will find the fissuring and the crab meat-like material over here. And finally, the severe stage 4 osteoarthritis, the arthroscopic finding is like this. The bone is exposed, the yellow part. So the horizontal axis represents the age, and the vertical axis represents the frequency and severity of the medial abrasion phenomenon. For the life cycle of the healthy knee, the green curve, when in our middle age, the bending of our knee is less severe, it will go along the green line. And this is a degenerative knee. It means that if you bend your knee more frequently and hardly, you will shift to the red line. The other factors make the green line to red line has been well documented by traditional medicine. It's talking about the risk factor of knee osteoarthritis. There's this female and the lifestyle, labor, and harmful exercise, obesity, and so on. But the traditional medicine do not know why. Now, if we put in the medial abrasion phenomenon here, suddenly we could explain why female is more preference. So you just think about daily activity of female people, have more frequent knee bending. Okay? So what is our solution according to this theory? We have 3 variable strategies to deal with the whole course of this disease. In the susceptibility stage and the preclinical stage, we use smart knee care to teach the people or patient how to take care of their knee according to the concept of abrasion phenomenon. And in the clinical stage, we use an arthroscopic surgery to treat the cause. And for the disability stage, we use precision arthroplasty. That means besides arthroplasty, the traditional one, we will also treat the medial abrasion phenomenon. Okay. First, I will talk about the smart knee care. I have wrote 2 Chinese books and 1 English book to teach people how to take care of their knee. And this might make 50% of the people can go reverse the natural cause of the red line. And for the critical stage, usually stage 2 and 3 osteoarthritis, I designed arthroscopic surgery to treat the cause, and it will rescue about 80% of patients and reverse their natural cause of degeneration. And what is ACRFP? It is an integrated arthroscopic surgery. After thorough arthroscopic examination, the surgical procedure will be decided and include the most important one is the medial release and lateral release, chondroplasty, removal of cartilage debris if needed. The surgical objective is to eliminate all detrimental factors and to improve the general environment of the knee for cartilage regeneration. Let me show you the key technique of medial release. We can see the abrasion over here and the very tight of the patella and the femur. The first stage, in the tiny space, we do very carefully to remove the distal part of the medial preca. This technique is technical demanding, so not ordinary orthopedic surgeon could do this surgery, okay? And secondary, we remove the proximal part of the medial preca. It's just like the membrane under the shell of an egg, very, very thin. So we take it very carefully to remove them all. And finally, we do the adjustment of the pressure between cartilage by using small scissors. And this is the most important part of this operation. If you do over, patient will be very uncomfortable. But if you do less, the symptom will come back very quickly. So we can see after surgery, the abrasion phenomenon has been removed, and the space between the cartilage is open. So we release the persistent pressure between cartilage, and this is very good for cartilage regeneration. And finally, if the patient's condition is going to the disability stage, we will do the precision arthroplasty for patient. And because we have taken out the cause of the pain, the medial abrasion phenomenon, so almost 1% of our patients are satisfied and do not have the unknown cause of pain and discomfort after arthroplasty. And this is our joint outpatient clinic. We recruit family doctors. Our vice superintendent, Dr. Lin, is over here. And geriatrician, rheumatologist, physical therapist to join and to combine care for the patient. And this is our protocol. First of all, we will recommend the smart knee care for half a year for every patient. Some will improve and don't need to receive surgery. And if the condition gets worse or no improve, we will suggest the arthroscopic surgery. And thereafter, we follow up patient yearly. And if no improve or become worse, then we will recommend arthroplasty, including uni compartment or total knee. And this is the treatment guidelines. For stage 1 patients, we recommend smart knee care. For stage 2 and 3, the ACRFP is recommended. And stage 4, the arthroplasty. And stage 5, arthroplasty, the total knee replacement. Okay. Steve Jobs once said, simple can be harder than complex. You have to work hard to get your thinking clean, to make it simple. So I compare the mainstream medicine to our KHPO option. For the mainstream medicine, because they don't know the cause, so all the treatment are passive. And it will waste time and waste money. And the knee osteoarthritis progress and hinder. And about 30% will finally need mainstream arthroplasty. And 30% of them are unhappy about the results. And how about the KHPO? Because we know the cause, so we treat it actively. By smart knee care, we can save more than 50% of patients. And if it fails, we use arthroscopic, the minimal invasive surgery. We could save another 80% of patients. So only 5% of our patients needs precision arthroplasty. And this arthroplasty will get nearly 100% happy patients. So finally, let's see the outcome. During a 1 year period, I treat 469 cases, totally 861 knees. And we follow up more than 3 years. The follow-up rate exceeds 90%. The female to male ratio is 5:1, and the mean age is 69 years old. And we think the total satisfactory rate is about 93%. For the ACRFP, it's 91%. The arthroplasty, nearly 100%. The subjective outcome of case score all are statistically improved. And the subscale of Coors is the scores. All are improved statistically. And the X-ray outcome of ACRFP found that 81% of reverse natural cause. Now I show you some evidence of cartilage regeneration. And this patient received ACRFP, and just 3.5 years old, year later, we could see the defect was filled by healthy cartilage. And this is another case. 1 year after surgery, we could see the reopen of the knee joint. And this is another case, very severe deformity. And 3 years thereafter, we can see the improvement of the cartilage. And we have many self-control cases. This one, he received operation over this side and no operation over here. And 6 years later, we can see the ACRF side, no symptom. Patient was very happy. But this side become more and more severe. So it's a very good self-control. And this is another one. The right side received operation, left side, no. And after 3 years, we can see no change, reverse natural course over right side. But the left side become more severe and deformed, and he need knee replaced. How about the long-term follow-up? This one is 8 years after. We can see the cartilage become very, very healthy. And the patient is very happy about the results. And this is a case of 10 years. Also, the narrowing space become more large and opened. This is the case we rescue a degenerated knee. And here is 1 year before surgery. And here is the just before surgery. we can see just 1 year the cartilage deteriorated to this degree. And we perform ACRFP for him. And 5 years later, we can see the reopen of the joint space. We also do some research about the MRI examination. And this is an example of cartilage regeneration proved by MRI study. Before surgery, we can see a cartilage defect over here. And 1 year after, the cartilage regrows over here. And I also have a chance to do the second root arthroscopy. This is when I do the ACRFP for this lady. 3 years later, she fell down and have got the hemoarthrosis. And I have the chance to do the second root arthroscopy and found that the defect over here was nicely regrowth. Okay, finally, let's see the cases, the case results.
那要做照三餐做，他说早晚午都是要在脚要在拉筋，现在很不错了，哎，现在我都不会痛。
The upper one is the pre-op X-ray, and here is the post-op. We can see the reopening of the joint space, and this is the second case.
多了，至于说后面会抽筋，我最痛苦、最严重的地方哈，现在1年多一次都没有发生，都非常满意目前的情况。我打球可以打2、3天打1次球，打网球啊，打1、2个钟头都没有问题，打高尔夫球打1、2个钟头也都没有问题。
In the X-ray taken 2 years after the surgery, we can see the reopen of the joint space. Now it's already 12 years after his surgery, and he is still enjoying his happy life here now. And this is the last cases, an English teacher.
我几乎都完全不痛了，所以对自己也比较放纵，就比较有希望，比较有冲劲，所以我的日子变得很忙。这1、2年来，我觉得我的生活达到了最高点，很有意义。我很喜欢这种生活，很忙碌，但是很充实，很快乐。
Okay, in conclusion, the KHPO brings new hope for people because an important etiology factor has been found. That is the medial abrasion phenomenon. And it could be treated by minimal invasive procedure. And we believe that the cartilage could regenerate if in a favorable environment, if we can remove all the detrimental factors in the knee. Okay? So we turn the degeneration condition into a treatable disease. This is very important because we know the cause. So since it is a disease, we should prevent it. We can prevent it. And if treated in time, we believe that the degeneration process could be reversed. Okay, thank you for your attention.